You're listening to OET Roleplay Practice with Kev, the English native.
Hello, welcome once again. So this is episode number 5 in my OET medicine roleplay examples. So this is the one, and it's all based on the official cards from OET.com, though the card and transcript, which will be available at the link below, is rewritten for copyright purposes. Anyway, this is one about 86-year-old patient, uses a walking frame and has mild back discomfort. Okay, so the patient's come to see you and he's got some issues with his back. And you have to talk through that, etc. So it's, it's pretty straightforward. Now, I tried using some different voices because, as I mentioned before, I make these using an AI tool, 11 Labs, for text to speech. Right? So I take the card, I write a script, check it against the criteria, and then I put it into 11 Labs, choose the voices. Anyway, it's a mixture of voices, different voices for this particular episode than the previous one. Anyway, so have a listen. Hope it helps. You can use it for pronunciation. As I said, you can do the shadowing, play a line, repeat it back, try and copy it. I've tried to get the audio as authentic as possible in that regards. So that should help, I hope, with the pronunciation. When I get the transcript transposed and mapped onto the official criteria, you'll be able to download that, then you can read along, copy, rehearse some of the lines. Okay, I've explained this in my other videos and articles on LinkedIn, etc. I'm going to make a video today, if I get time, showing how you can use these audio files and Grok AI tool to speak to and practice your speaking. Anyway, I'll put links to the various things below if you're watching on Spotify, listening on Spotify. And okay, I hope that helps.
Good morning, I'm Dr. Maria, your GP today. Could I confirm your name, please?
Yes, it's Mr. Dean.
Lovely to meet you. Please take your time getting comfortable. What brings you in today?
I woke up this morning with some discomfort in my lower back. Not sharp pain, just uncomfortable, and I'm afraid I might have damaged it.
I'm sorry to hear that. So you say you first noticed it this morning?
That's right, this morning when I got out of bed. Last night I was fine.
So let's talk about that and see how I can help. How's that sound?
Sounds good, doctor.
If you don't mind, let me get some details. So you say it's in the lower back. Is that right?
That's right, mostly in the middle, lower back.
On a scale from 0 to 10, how would you rate it?
Well, it's not really painful, doctor, just some discomfort. But it definitely feels that something's not quite right there.
Any numbness, tingling, weakness, or bladder or bowel problems?
No, none of that.
Any falls or injuries recently?
None. I did my chair exercise class yesterday, but nothing happened then.
Chair exercise? You go regularly?
Yes, every week. I find it helpful, especially since I use a walking frame.
That's excellent. Those classes often help posture, strength, and mood. What worries you most about this discomfort?
I'm worried I've damaged something, and whether I should stop the classes altogether.
That's a valid concern, Mr. Dean. Based on what you've told me, mild central lower back discomfort after getting up, no injury, no nerve symptoms. This sounds most like a simple muscular strain. It's uncomfortable, but not serious, and usually settles with rest and gentle care.
That's a relief.
To To be thorough, I'd like to do a brief physical examination. Look at your posture and movement and gently feel the muscles in your lower back. Would that be all right?
Yes, that's fine.
Before we examine, let's talk about your exercise question. For a few days, it's best to avoid anything that worsens the discomfort. I recommend skipping next week's class to give your back time to settle.
I'd hoped not to miss it, but if it's wiser, I can.
I understand it's frustrating to pause. The aim isn't to stop being active, it's to prevent a small strain becoming a bigger one. During the week off, keep gentle movements at home, short walks with your frame, sitting and standing slowly, and simple posture resets in the chair. Avoid bending and twisting quickly.
All right, I can do that.
For comfort, a warm pack over the lower back 10 to 15 minutes at a time can help relax the muscles. And if you need medication, paracetamol taken as directed is a reasonable first option.
I'll try warmth first and see.
Excellent. And when you go back, let the instructor know you've had a mild back strain and avoid anything that causes discomfort, especially twisting or bending. Moving within your comfort zone is absolutely fine.
That sounds sensible. I don't want to give them up permanently.
And you don't need to. We'll pause to recover, then resume gradually. How does that plan sit with you?
I'm relieved. I thought you might say stop altogether.
Not at all. We want you to stay active, just safely. Do you feel safe at home with your walking frame? Any recent near misses or stumbles?
No, I'm careful.
Good. Let me summarise. This morning you noticed mild central lower back discomfort, no injury, no leg symptoms, no bladder or bowel issues. We suspect a mild muscular strain. The plan is 1 week off the class, gentle daily movement, warmth for comfort, paracetamol if needed, and then a gradual return, avoiding any moves that aggravate it. We'll also do a brief physical exam now to confirm. Anything I've missed?
No, that covers it. Thank you.
Wonderful. Just so you're clear, if you develop severe or worsening pain, numbness, weakness, pain spreading down a leg, fevers, or any change in bladder or bowel control, please contact us urgently or seek immediate care. Those would be unusual, but I want you to know exactly what to watch for.
I appreciate that.
Excellent. After the week's rest, if you're comfortable, go back to the class and tell the instructor you're pacing yourself. If it's not improving after 2 weeks, or if anything worries you sooner, we'll review again.
That seems clear.
You're welcome. Shall we go ahead with the examination now?
Yes, I'm ready.
All right, I'll help you stand. We'll start with a look at your posture, then some small movements. Tell me at once if anything feels uncomfortable. Ready?
Ready.
Good. Most simple strains settle well with this approach. We'll make sure you're supported at each step. After the exam, I'll print your posture tips and note the plan on your record. We'll get you back to your class safely.
Thank you. That puts my mind at ease.
My pleasure. Let's begin.
Okay, there you go. Quite interesting, I think. I hope that gives you some idea. So, as I said, pronunciation, you can use it as a model for that. And any comments, you can contact me. You can, add comments here on Spotify. I don't think I'm going to put this on YouTube. I think I'll just keep them here on Spotify. And of course, if you're one of my students on italki, you can give me some comments there. Or if there's anything you want to ask me, you can contact me on LinkedIn, italki, etc. All the links will be in the description below this audio. So, hope that helps. I'm going to try and do 1 a week, maybe more of these audios. It depends on time. As you know, I've got so many projects on and so many students, etc. It's not easy to find the time to make all this material. Anyway, that's enough from me for now. As I said, any questions, comments, feel free to get in touch, and see you. Well, see, I keep saying that. I won't see you at all. You will hear me next time. Okay.
Thanks for listening to OET Roleplay Practice with the English Native. Join me next time for more practice and tips.